Overactive bladder is a common debilitating condition characterized by an urgent need to urinate, even when the bladder isn't full. Symptoms include having to urinate more than 8 times a day, having a strong and sudden urge to use the washroom, and involuntary wetting accidents. Unfortunately, many people think symptoms are a normal part of aging, or they're too self-conscious to tell their physician.
It started a few years ago when I noticed a change in my bladder pattern, but I didn't think of anything. And last year it became more frequent. In the daytime, it's like the first time when you get up, and then before breakfast, and then when I go to work, it's really the same thing. You have to go to the bathroom frequently. And if one bathroom is occupied, you run to the next one and hope it's not, because otherwise you won't make it.
More than an inconvenience or embarrassment, overactive bladder is associated with increased health risks and decreased quality of life. It can even lead to diminished sexual function. Maureen McGrath is a nurse continence advisor. She says overactive bladder doesn't have to have a negative impact on a patient's quality of life or their love life.
Overactive bladder has a very negative effect on intimate relationships, as you can imagine. The main reason is that people fear they will leak urine during intimate moments, which can be very embarrassing. This can affect your self-confidence and ultimately impact your sexual self-esteem. So you may not feel as good about yourself, or you may not want to desire sex with your partner, and that can have a negative impact on the relationship. Fortunately, though, there are treatments available for people with overactive bladder, and no longer do they need to suffer in silence.
Until recently, oral medication called oxybutynin had been the drug treatment of choice. However, oral therapies are often associated with troubling side effects such as dry mouth and constipation, often causing patients to discontinue use. Now, a new option is available, providing patients with a novel alternative with few side effects.
Gelneek is a special formulation of oxybutynin that's in the form of a gel. And the special attribute of this is that it has drastically cut down on the side effects that we used to see with oxybutynin. With ordinary oxybutynin, the side effects were about 60% of patients had dry mouth. With Gelneek, it's only about 7%. So it's cut down drastically on the dry mouth rate. And similarly, constipation is also less. Gelneek comes in a sachet, and the sachet is opened by the patient and applied to skin areas once a day. And it dries, and then it gets absorbed through the skin. And because of the way it was designed with skin absorption, the side effects are better than the traditional oral form of the medication called oxybutynin.
Patients should speak to their physician about the symptoms of overactive bladder and the treatment options available to help successfully manage this condition.